Does anyone here have a press release I could take back to the station?
Yes. Give me just 1 second. I'm going to bring it.
Thank you very much.
No problem.
Appreciate it.
Good afternoon, everyone. Thank you for joining us. I am Assemblymember Dr. Joaquin Arambula, and so pleased and honored that you came to our Hope for All press conference today. I have the honor of representing 14 cities in Fresno County, the #1 ag-producing county in our state. Cities like Fresno, Fowler, Firebaugh, Mendota, San Joaquin, Huron, Coalinga, Selma, Kingsburg, Carlier, Reedley, Sanger, and Orange Coast. Many unincorporated areas like Viola, Layton, Lanier, Nampua Creek, and Del Rey. It was in many of those small unincorporated cities that I had the privilege of giving vaccines during this pandemic of the century. And it was in Del Rey that I had a chance to give the vaccine to our next speaker and civil rights icon, Dolores Huerta. But it was when I was face to face with my community, when I was talking with many from the immigrant communities, that it motivated me, it inspired me, and it made us realize why we need health for all now more than ever. So without further ado, could you please help me to welcome Dolores Huerta.
Thank you very much, Dr. Arambula, and I want to thank the press for joining us this morning. And we are here with a delegation from the Central Valley. So we have here folks all the way from Auburn, California, Bakersfield, California, Tulare, the Boston Central area. And it's very busy gathering postcards because we are supporting Dr. Arambula's bills, AB4, healthcare for all. And so we're here today to present these postcards to the leadership, to Assembly Speaker Anthony Rendon, to Senator Toni, and of course to our great Governor Gavin Newsom. And we are asking them to please support AB4, Dr. Arambula's bill, because we know that we want to get all of the people in California covered with our wonderful medical we have here. And we know that many of our undocumented people, unfortunately, are not qualified for our health care coverage that we have here. And so this is our campaign. We know that all of us in our state we cannot be protected unless everybody is protected. Our undocumented families here, we know that many of our workers are undocumented. They are essential workers. They do the heavy lifting to keep our people in California fed and safe and to make sure that they're healthy. They contribute millions of dollars to our economy, not only by what they consume, but also the taxes that they pay, contributions to Social Security, and taking care of our children, taking care of our elders, and of course, out there in the fields every day, and it's hot sun taking the food for all of us to eat. So we know that our undocumented families here, that they also need the kind of health coverage that we have for the rest of our Californians. And so we are here today, and we are going to be presenting some postcards here to the governor, and to really urge him to please support us on having health care for all, to support AB4. Si se puede, we can do this. And now we are going to introduce Senator Marielana Duraso, a champion for workers in the state of California, and I would like her to step forward. Thank you very much for being here.
I want to thank you, Dolores, for your moving and impactful words. It's important to have your advocacy, and it's an honor to be standing side by side, shoulder to shoulder, fighting and working with you in this movement. Racism is a public health emergency. We watched painfully what happened to our communities of color, to our immigrant brothers and sisters who bore the brunt during this pandemic. While we continue to wait for a federal government to pass comprehensive immigration reform, which has taken too long and perpetuates systemic racism, we must act with urgency now. California has a legacy of leading by expanding coverage to those who are most vulnerable in our state. In 2015, we expanded to undocumented children. In 2019, we expanded to young adults. And this year, AB4 continues in that same vein to expand health care coverage to all undocumented adults who are income eligible. Simply put, this bill ends the exclusion based solely on immigration status. By removing immigration status as an eligibility barrier to Medi-Cal, California can build a more universal and equitable healthcare system for all who call this state home. Now is the time for us to be anti-racist, for us to be intentional and to invest in all Californians' essential needs to achieve equity in healthcare access. After battling through this pandemic of the century, it's time for us, and we must provide those who are taxpaying Californians who have contributed to our economy and our workforce for decades with the resources to be safe and healthy. We must invest in the health of our state when we invest in the health coverage for those who are low-income, undocumented adults who are a part of our workforce and communities. It's an honor to work in this movement to figure out how we can expand healthcare coverage, and now is the time for us to make sure that we get AB4 signed. With that, I'd like to invite up to the lectern a colleague of mine, a real champion for immigrant rights, who I'm pleased to partner and work together on SB 56. Can you help me to introduce Senator Duraso?
Thank you so much, and it's always so great to be with my colleagues, Majority Leader Eloise Reyes Gomez, Assembly Member Gibson, Dr. Assembly Member Arambula, and the leader of the moment, especially for Latino and immigrants' rights, our sister, Dolores Huerta. You She teaches us how to make the connection between environmental issues, women's and feminist issues, LGBTQ, health issues, immigrants. We are all one community. We are all Californians. And shame on anybody who wants to pit us against each other, because we have a leader like Dolores and others who say we are one community. We are one state. And when it comes to health care, we are all Californians. We are all contributors to this state. And therefore, we are all standing with each other saying health for all. Health for everybody. No distinction. We're all human beings. We all contribute. And I think that's what the most important message is that we have been fighting for, is don't treat us any different. When they're working in the fields, when they're working in the garment shops, when they're working in hospitals, nobody stops to say, wait a minute, are you here as a citizen or are you here as undocumented? No, everybody's doing their work. We would not have the food supply during the pandemic had it not been for undocumented immigrants in the state of California putting the food on our shelters and our grocery stores. So let's be real. That's what this is all about, treating us all as equal human beings. Plus, sisters and brothers, it doesn't make sense on a healthcare issue to separate us. One, economically, it costs more what we're doing now. We are paying for undocumented to go to emergency. We have to pay for that. So we wait, they have to wait until they are so ill that they go to emergency shelter, they go to emergency rooms. Why not pay for them to get preventative care? Preventative care. That would be much better use of our tax dollars than waiting for them to be so ill that they have to go. And then we don't treat the illness, we treat the symptoms for that very moment. So it just doesn't make sense. It's morally wrong, and we are here to do the right thing. We ask our leadership. I'm proud that leadership of both the Assembly and the Senate have said, let's take a big step forward, but that doesn't mean we stop there. Taking a big step forward means at least our 50 and up sisters and brothers undocumented. It also means that we want everyone to be covered. Everyone. Nobody should be left out. That's what we're all about. That's what our goal is. Let's remember that. So, ¿se puede? Sí se puede. ¿Se puede? Sí se puede. 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 Muchas gracias.
Thank you, Senator Duraso, for those powerful words and reminding us why you are such a powerful labor leader. It's such an honor to be a representative and colleague with you. Next, we have our Assembly Majority Leader, Eloise Gomez Reyes, to provide some comments.
Thank you so much, Dr. Arámbula, my dear friend. Estoy muy orgullosa de estar aquí con todos ustedes, de tener aquí con nosotros el chairman del partido de los asambleístas, Assembly Member Mike Gibson, de la senadora Marielana Duraso, el doctor asambleísta Joaquín Arámbula, y como nos ha dicho nuestra senadora, la gran líder de todos los derechos civiles, Dolores Huerta. Es un orgullo estar así. Con Dolores todo se puede. Con Dolores todo se puede. Sabemos que el derecho a la salud es un derecho humano y así deberíamos verlo. Es un derecho humano, no es de que le toca a uno y no le toca a otro. Si hemos determinado que todos los inmigrantes son esencial para todo lo que ha pasado desde la economía aquí en California, entonces tenemos que tratarlos como esenciales y darles el derecho humano, el derecho con dignidad de que ellos también cuentan. Cuando estamos hablando del derecho a la salud, tenemos que decir que es importante que cada uno de ellos tenga el derecho de tener cuidado a su salud. No solamente uno o solamente el otro. Todos tenemos ese derecho como seres humanos de tener el derecho de tener el cuidado de nuestra salud. Vimos en una manera muy clara que durante este tiempo de COVID, de la pandemia, que nuestros trabajadores esenciales, muchos de ellos inmigrantes, los considerábamos los más importantes, pero ahora que ellos necesitan el cuidado de la salud, ahora decimos que no son tan esencial. No es tan importante esto, es muy importante. Y por eso es que estamos aquí para estas dos propuestas, de asegurar que nuestra comunidad inmigrante sea incluida, que cuando determinemos a quién le pertenece el cuidado de salud, que a todos le pertenece, no vamos a ver cuál es el estatus migratorio. Eso no es algo que se tiene que tomar en cuenta. Solamente tenemos que saber, es un ser humano que vive en California, a ella le toca, a la familia le toca, es todo lo que debemos de ver. Así es que le damos muchas gracias a ustedes por estar aquí con nosotros y para la comunidad que nos está apoyando aquí, que está apoyando a toda la comunidad para asegurar que sea salud para todos, health for all. Muchísimas gracias.
Thank you, Majority Leader. Next, we will hear from our Democratic Caucus Chair, Assemblymember Mike Gibson.
Thank you very much, Dr. Rambula. First of all, happy to be here. I'm happy to stand shoulder to shoulder with these incredible giants, making sure that our voices are heard loud and clear to the highest level of government. It is absolutely important, one, that we pass this bill. Not only pass this bill, but also make sure that we fund it as well. It is absolutely critical. We cannot have two Californias, one who have health care and the other who have no health care. We are one California, and today we are united to making sure that our voices are elevated and raised, that we want one California, everyone covered, health care for all. Thank you very much, and God bless you all.
I like your passion, Mike. Next, we will hear from a community member, Laura Cruz. Please help me to welcome Laura to the mic.
Buenas tardes a todos. Mi nombre es Laura Cruz. Vengo desde Kesfield, del condado de Kern. Vengo a abogar y apoyar a nuestra comunidad más vulnerable como lo somos los trabajadores esenciales, incluyendo los trabajadores del campo. Que sin ellos tuviéramos comida en esta pandemia. Y como lo están diciendo, nadie los tomó en cuenta. Hasta ahorita nunca nos faltó de comer en nuestra mesa. Y ahorita que ellos lo necesitan, no nos acordamos de ellos. Eso no es justo. Durante la pandemia perdimos muchas vidas, incluyendo familias completas, incluyendo abuelos, tíos, amigos, vecinos. Desafortunadamente no vamos a un chequeo al doctor porque sabemos el costo tan caro que es de una factura. La Asamblea y el Senador apoyan la propuesta AB4. Solo falta su apoyo, gobernador Newsom. Por favor, necesitamos su apoyo urgentemente. Piensen que somos su familia y actúen con el corazón. La atención médica es un derecho humano, no debe haber restricciones. Recuerde, actúe con el corazón. Si nosotros, la comunidad de California lo necesita, apoye la AB4. Gracias.
Thank you, Laura, for those words. I would like to now introduce joint author, Assemblymember David Chu to the mic.
Good morning, buenos dias, Dagaho. I'm David Chu, proud to represent San Francisco in the state legislature. And I'm sorry I'm a little bit late because I brought my son to work today. He's 5 years old. He's sitting in the corner over there. I mention that because in 1994, I first started working on these issues. You all remember what happened in 1994. Proposition 187 was not only put on the ballot, but it was passed by the voters of California. And at that time, California decided that it was okay to say to a 5-year-old kid, because of your immigration status, you should be denied health care. And I think there are so many of us who are here today, certainly Dolores Huerta, certainly my colleagues, but so many activists who realized what it meant for us to truly say we need health care for all. It is important also for me to join today because I stand as the immediate past chair of the API Legislative Caucus, representing a community where 1 out of 5 of our undocumented Californians come from. Our API community represent the diversity of so many different countries whose immigrants have not been able to get the health care that they need. And I know you've probably heard today a lot about how during this time period of pandemic, the idea that folks would be denied health care is just wrong. All of us have been involved in this struggle for many years. I have been a proud joint author of every bill that Joaquin Arambula has introduced over the last 4 years, and we have made steps toward justice. We have been able to get health care for kids who lack immigration status, then health care for young adults, then health care for seniors over the age of 65. But we have to do more. We have to do more. We've got to keep this fight going until every Californian, frankly, until every American, regardless of your immigration status, has access to the same health care as all the rest of us. And I will tell you, as a former immigrant rights attorney, this is the right thing to do. This is not just the right thing to do for our immigrant families, but this is how we're going to keep all of our families safe. I want to make sure that when my kid goes to school, that every single one of his classmates have health care, and all of their parents have health care, and all of their grandparents and aunts and uncles, because this is who we ought to be as a society. Let me just end by saying that we know the arc of the moral universe is long, and it takes steps like getting health care for kids and then young adults and then older seniors and then less old seniors and then those of us who are about to become seniors. We've got to make sure that this happens. This is the year to do it. This is the year to show California who we are, what our values are about. And I know that with all of you standing behind us, we're going to get it done, all right? Si se puede? Se puede? Thank you, guys.
I'd like to now invite Dolores Huerta back up to the mic to see if she has any closing thoughts before we give the postcards that we've gotten from so many thousands of Californians to our governor. Dolores Huerta.
Again, I want to thank everyone who joined us here today. Thank you so much for all the great work that you're doing for all of our people here in the state of California, especially our undocumented residents in the state. And now we would like to present the postcards that we've been gathering. I do want to say to the governor and to Senator Pro Tem Toni Atkins and to Speaker Rendon, this is a down payment because we're going to be continuing gathering postcards and petitions right up until the time that we can have health care for every single person in the state of California. So por favor, la tarjeta. So we are going to present these to the governor's office. Thank you very much. The governor's representative, Nitos, vamos a dar un aplauso para ella, por favor. Thank you very much for receiving the postcard. And thank you very much. And I just tell the governor that we are going to continue to gathering more and more. So next time we'll need a much bigger box. Okay? So thank you very much. Thank you very much. Again, thank you all very much for coming, and we're going to continue this campaign because I know that everybody here feels the same way that we do, that we have to have every single person in our state of California have to have the health coverage that they deserve. And as was said by so many people, we know that we can have a healthy California when everybody has health care coverage. Si se puede, muchas gracias a todos. Thank you very much. Thank you very much.
To get a drink of water first and everything? You want to do it under the shade?
Yes, that'd
That'd be great. I'll set up over here.
Yes, I would like to thank Carlos Alcala, who is the head of the Hispanic Democrats, who joined us today, and also for Juanita Ontiveros. I saw her here a moment ago. Oh, here she is with Sierra Ley, who is also joining us today. Thank you very much, everybody. Gracias. Thank you very much. Thank you.